So today we are going to hear from a panel of 4 experts. They provide personal and professional insights on navigating educational challenges during COVID-19. We'll then open it up for questions from all of you. So before I introduce our panelists, I have a few housekeeping items that I'd like to review. You are muted for this webinar and your video is disabled, but we welcome questions during and after the opening remarks. Please type your questions into the Q&A feature found at the bottom of the Zoom window. Our expert panel is comprised of educational experts and also the parent of a child who was diagnosed with a brain tumor. Feel free to ask questions of our educational experts and also questions you might want to ask of another parent. We will not get to every question today, but we will try to get to as many questions as possible. It's my pleasure now to introduce our panelists to you. Peggy Mazzarella has an extensive background in working with children and adolescents with disabilities and their families, having worked in public education for 31 years as a special education teacher, administrator, and university instructor. Peggy is an acquired traumatic brain injury consultant and advocate in California. Courtney Emery is the school intervention specialist in the Dance Blue Kentucky Children's Hospital Hematology Oncology Clinic in Lexington, Kentucky. Courtney earned a Master of Education in Educational Leadership and is certified by the National Board for Professional Teaching Standards. Brandy Wax has been a public school kindergarten and first grade teacher for 13 years. She's also the parent to 3 children, the oldest of whom is a 9-year survivor of congenital brain tumor. Her family has been participating in the Pediatric Brain Tumor Foundation's Northern California family camps and parent outreach and support for 8 years. Octavio Zavala leads the School Transition and Re-Entry Service in the Children's Cancer Center for Cancer and Blood Diseases at Children's Hospital Los Angeles, helping parents and patients obtain school-based accommodations and special education services by providing them with the information and tools they need to advocate for such services. Octavio is a survivor of childhood cancer. Right now, it gives me great pleasure to introduce our first panelist, Peggy Mazzarella, for opening remarks.
Hello, everyone. Good afternoon, good evening. I'm honored to have been asked by the Pediatric Brain Tumor Foundation to participate on this panel. It's trite to say that we're living in unprecedented times, but our whole world shifted overnight and has become even more isolating than it already was for children with brain tumors and their families. As a society, we're fortunate to have the technology to hold school virtually, but unfortunately it hasn't worked out for all learners, especially those with different learning needs. The families I work with struggle with being able to get their child in front of a laptop for class meetings and service provider sessions, as well as seeing an increase in behavior meltdowns at home. School systems don't understand brain injury and brain tumors and their unique impact on the developing brain. Pediatric brain injury is even more mysterious to educators than other disabilities like autism and learning disabilities. It is barely touched on in university special education teacher preparation programs, other than maybe a section in a textbook chapter. Fortunately, professional sports has brought head injury to the public's awareness, so at least schools are beginning to understand concussion and its impact to the developing brain. But the additional piece that schools need to understand is that for children with brain tumors, there are their current and long-term implications of the chemo and the radiation therapies on the developing brain. Unfortunately, the burden of advocacy for a child with a brain tumor often falls on the family. But you don't need to figure this all out on your own. School is obligated to assist you. School agencies are required to have an educator with expertise and certification in brain injury available to be on your child's team. This could be someone on the staff or an outside consultant they bring in. If you feel like your existing team is not meeting your child's needs, I recommend that you submit a written request for an IEP meeting and also request they provide a certified expert in pediatric brain injury to participate on your child's team. The role of this individual is to guide the team figuring out what accommodations, modifications, services your child may need, and to serve as the link between you, the medical professionals, and the educators. Another piece of advice that I have if you and your child are struggling with virtual learning is to first of all be kind to yourself and don't feel you need to be perfect, and know that you're not alone in the struggle. I recently read an article written by a homeschooling parent with advice to parents who are now tasked with helping their child with virtual schooling. And the woman shared she thought it was unreasonable to expect kids and parents to sit in front of a computer for 6 hours daily. She also shared that homeschool schedules are more fluid typically and not crammed into the traditional 6-hour school day. Perhaps your child's team could get creative with your child's schedule. She also suggested learning opportunities could be built into routine chores and household activities, such as cooking and doing laundry. I provided Heather and Kathy with resources that they will share with you for surviving virtual instruction. I have a few suggestions. A big one I really recommend is creating a visual schedule with your child that includes everything in the day: wake and bed times, school meeting times, meals and other breaks, maybe some family outings, and incorporate short breaks after 10 minutes of learning into that schedule. Use photographs to accompany the schedule of them in participating in the activities that are on the schedule. Teach using music and movement, and especially use that for transitions between activities, and have the children choose their music. And I've included a website resource called Go Noodle. That is a free site with videos, music, and games to make learning more fun. I know this sounds corny, but enjoy the time you have at home with your family and children. As challenging as these times are, which they are, I really think people might look back and be grateful for some of the things that came out of this crazy isolation. And one of them probably will be having that extra time with families. I am now going to pass the baton to Courtney Emery.
Thank you, Peggy. And thank you for allowing me to be part of this panel today. I feel very honored and definitely not worthy of the term expert, but I appreciate Kathy saying that. As she mentioned, I'm an educator. I work in a clinic, a hematology oncology clinic, and I work as a liaison between the family, the schools, and the medical team. Prior to that, I was in the classroom, so I come with a lot of experience as an educator. And my goal is to make this as easy as possible during such a difficult time. I think that the big word that we hear all the time and that we feel personally is challenged and spread too thin. That's what I hear daily, hourly, every few minutes right now. So if you are feeling that way, you are most definitely not alone. And I would challenge you to use this time to ask questions, to help us, to give us the opportunity to answer those questions for you. But just know that you're not alone, and please feel free to follow up anytime. I'm happy to talk to anybody if I can do anything to make this a little bit easier. Something that is important to remember during this time is that educational plans and the laws that protect those plans are still around and still very valid during virtual learning. So the two big plans that children can have are called 504 or IEP, or Individualized Education Plan. If your child does not have one of those plans in place, but they could benefit from extra support in the classroom, I would really challenge you to reach out to the school and attempt to get one of those plans in place. There is an evaluation process. There is paperwork and possibly additional testing that has to be done. But those plans are in place to legally protect your child. One of the resources that will come out to you in a few days is actually just a one-page document that compares the difference between a 504 and an IEP, so that you can determine which one will be best for your child. But know that if your child has that in place, and it comes with accommodations, it may come with specially designed instruction, all of that is your child's right, whether they're in the classroom or they're at home or they're in the hospital, whatever their learning environment is. So please know that that is available to your child. And if the school is not providing that, As Peggy stated, I would challenge you to request a meeting with the school to discuss that further. And if there's extra resources that you can, extra people that you can have at the table with you to help advocate for your child's needs, I challenge you to get those people involved. So again, I appreciate this opportunity to be on the board. I look forward to answering some questions, and I'm going to pass it on to Brandy.
Thank you. Hi, I'm Brandy Wex. It looks like I have the honor of being one of the only parents here on the panel. So I'm going to share that part of my experience first. My daughter Scarlett is almost 10 years old. She was diagnosed at 2 months old with a congenital glioblastoma, a brain tumor that was about the size of my fist. She underwent extensive surgery over several weeks and a year of chemotherapy, and then we had a recurrence with more surgery and more chemotherapy that ended when she was about 3 years old. Since that point, she has had a whole range of long-term consequences, I guess you could say, from the tumor and the treatment and all of the other things that went along with it. So she had a stroke in surgery, and we deal with the consequences of that and stroke damage. She has hearing loss, vision impairment, cognitive delays, some mobility delays, and we're still dealing with all of that on a daily basis, as well as behavioral issues. She's had a different IEP she's had an IEP since she was 3 years old. And we have had up to 20, 30 goals in her IEPs, meetings that go over 2 or 3 or 4 meetings to get accomplished, where it becomes time to just start over for the next year by the time you get everybody in the meeting. My husband has become a stay-at-home parent to care for her and our now other children. And he's also become an educational advocate for her and for other people as well. It's part of the job at this point. Is parenting is also part of advocacy. We are struggling like everybody else. So Scarlett is 9, and then we have a 5-year-old who just started kindergarten last week. And we thought it was a great idea. We signed him up for a dual immersion kindergarten back in February. So we are also learning Spanish alongside him on the computer. And we have an 18-month-old who is really, really wanting to come in this room right now with me. So I am with you. The other side of my life is Mrs. Wex. I am a first grade teacher here in the Bay Area. We are still on stay-at-home orders for the most part. Our students are 100% virtual. We have been that way since March. So I went from one day teaching in the classroom to the next day teaching virtually to students who don't have necessarily all the technology they need or the skills they need or the parents at home or the support that they need. I am trying to figure that out with them as well as with my own kids who really, that's not the way I envisioned them learning either. And I recognize all of the problems and more. The biggest thing that I can say right now is that we are all in it to do the best that we can do for the kids and for ourselves. I don't want to be tortured by online learning, and neither do I want that for the children. I would really advocate for parents to communicate with the teacher the best that you can. We're doing our best with my children's teachers at this point, trying to explain to them, hey, we missed that Zoom link. I missed an assessment. We are just trying to catch a schedule that makes sense for us. And communicating that with the teachers is the best thing we can do. Trying to get them on our side and helping them understand the challenges that we're facing here at home with the things that they're offering to us. I am very open to suggestions from parents for my classroom schedule as well, understanding that I am not there and kids are not going to behave the same way at home that they do at school. The situation is completely different, and we all need to be really accommodating of that for our students and for ourselves. I think the best thing that we can do at this point is just keep going forward one day at a time, waiting to see what's next. I know there are families out there that are doing hybrid school and who are, sending their kids to school full time, and they all come with their own kinds of challenges and the benefits and benefits for parents and benefits for teachers and challenges for everyone involved. So I included some resources as well, and one of my favorites, along with GoNoodle that Peggy offered, is also Teachers Pay Teachers. So often as we're approaching looking at our students' goals and trying to figure out how we're going to meet them at home, there are thousands and thousands and thousands of free resources out there provided by teachers and speech therapists and occupational therapists. And one of the best resources out there to find those is Teachers Pay Teachers, where teachers upload their own resources. So some of them are free. Everybody who joins is required to have some free items, but there's also a lot of things that are really worth the money that you pay for them, including picture schedules, sight words, speech practicing activities. There's a ton of things, digital and paper. So that was one of the things I wanted to mention. Thank you so much for having me here today. I'm going to hand it off to Octavio.
All right. Well, that's just, I mean, it's very difficult to come after all those wonderful speakers, and they've covered a lot of things that I would have said. So I think the first thing I'm going to say is ditto. But also, in my role at Children's Hospital, you know, what I do is I assess, you know, I assess a child's, a patient's school-based needs based on what the parents tell me, based on what recommendations the medical team has. And then I help families, I help gather information and tools for the families, put it together, and I consult with the families with the purpose of helping them be the best advocates they can be for their children. And so in other words, the model of the service that I provide at the hospital is focused on parent empowerment, and to a large extent as possible, patient empowerment. What can you all do to advocate for yourselves in the school? And so it just so happens that in doing that kind of work in that way, a lot of times parents come to me with questions, or they just discuss their concerns about, what am I doing wrong? What could I do more? And more often than not, I have them then reframe that question. Well, what is the school doing? What can the school do? In preparation for this webinar, we received some questions that parents uploaded ahead of time. And a lot of them, you can sense there's a lot of a feeling of like, this is, what can I do? Like they're shouldering the burden all themselves. And understand that, at least from my approach is always to have the questions asked, well, what can the school do? What is the school not doing? Can the school do more? So understand, and some people that spoke before me, they mentioned IEPs, 504 plans. We mentioned the laws that form the foundation of these, and the fact that that schools have not been granted a waiver for any of these. The U.S. Department, the Secretary of Education, said that schools have to implement these IEPs and 504 plans as is, even during the COVID closures. And so when you sit and you think about everything that you're going through and managing, all the challenges with remote learning, with distance learning, especially with a special needs child, remember that the first question should always be, from my point of view, is what is the school doing, and can the school do more? And then, your strategy should be about how you can advocate for those things from the school. But make sure that I would always start by inventorying what is the school doing? Is it doing enough? The other thing that I'm going to say is that, all of us, brain tumor patients or not, we're all, COVID has presented an unprecedented challenges for all of us. I myself am a parent of a 5-year-old who's starting his school is starting kindergarten 100% virtually. He is also in a dual language immersion program, and it has not been easy. It has not been easy. And so, all of us as parents have to understand that the first couple of weeks are dedicated. You have to be dedicated more to just, ironing out the kinks, getting the system at play, getting our routine down. And so it's not easy for any of us. But of course, those of you who have a child or who are pediatric brain tumor patients or survivors probably have additional challenge on top of what everybody else does. I do want to point out, though, that also because of that, you may have access to other resources that maybe not everybody has. And one thing that I always remind our survivor families is that when you're looking for assistance, when you're looking for help, when you're looking for information, either direct assistance in the form of some kind of direct support, counseling or guidance, or someone that you can turn to for help or guidance on how to do something. Remember that, you know, it's quite possible that your treatment center, you have a team. You have a team of people, of not only your physicians and nurse practitioners, but you have your social workers, your child life specialists, your school reentry specialists, or some kind of school specialists like some of the other speakers on this panel. So understand that although you've had the additional, very difficult, devastating challenge of having a child with a brain tumor, that also maybe afford you some resources that can become very handy, be very useful during this very difficult time of COVID. Hand it to Kathy.
Thank you. And thank you to our panelists. You are a terrific group of folks, and I've already learned so much from you just by your introductory remarks. So thank you so much for being here today. And right now I'd like to invite all of our panelists to unmute yourselves, and we're going to open it up for some questions and some discussion. If you have a question for one of our panelists, please type it in to the Q&A feature at the bottom of your Zoom window. As Octavio mentioned, we've already received a few questions from registration. So I'll begin with those questions, and then we'll take some more as they come in. I'll start with Peggy. Peggy, one of the questions that came in is, what questions should I ask my child's school personnel when weighing the cost benefit of returning to in-person learning?
Well, I think the questions that should be asked are certainly regarding PPE and making sure they have the proper equipment to be able to have in-person learning. And many of the school districts are coming up with pretty rigid criteria for how they're going to manage in-person instruction based on their local health department. And so I would think that that's posted probably already. Weighing the return, of course, for your child there's a lot at stake when you've got a child who might be going through treatment. So, you know, that certainly, to me, would be very scary. I would weigh their health and safety and being home, of course, as opposed to having them return to in-person instruction. If they have and are in the process, of course, of their treatment. You know, I'm a huge, this time is not, our kids with special needs are really suffering as a result of not being in school. And everybody is, because the socialization is limited and all of that. And so there are so many, that's a big question. I guess I have so many more questions to answer that question. I'm a big question asker, so I think I would probably like to hear from our teacher on the panel as well, to see what, I mean, would be curious to see what you think would be a good parent question, the parent questions that should be asked of you to ensure, or to weigh the benefit.
Yeah, I will say that it hasn't even been offered to us to have in-person instruction, so we haven't had to go there. My classroom right now, I'm calling it my teaching closet, because they took out all my tables and desks. I have 10 desks left, and they've removed all of the soft furnishings, no rugs, no bean bags. It's not my classroom anymore, so I'm not really thinking of it as that. It would take a huge shift in my understanding of how we can proceed before I can even look at having kids there. It's a very different beginning of school year than any other time before. So I will say I haven't had to face that quite yet for me or for my own children. When I think about for my daughter attending school, I mean, we have done a lot of training on how to wear a mask in public. We've tried going to the zoo, and we've tried, you know, we avoid most places, but we have gone to some places we feel like we can be relatively safe. She really struggles with even the most basic things. Hand sanitizer stings and masks get in her way. We've learned we need to take multiple masks. So that's something I learned for my students. I'm going to probably need to have parents send more than one for their kids. Very small things that seem like a pretty typical expectation of most kids are going to be an extraordinary imposition on my daughter. She's hard of hearing, so having masks covering faces is really invasive to her learning and to her understanding. The masks go over her ears where her hearing aids are. So that's something that's really uncomfortable for her. It makes her really unlikely to wear her hearing aids. So I think it's a case by case basis for a lot of kids, and kids who have a lot of equipment, like maybe my child. It's really something I'm not sure how she's going to proceed. It doesn't matter how cute the mask is. I'm not going to be able to keep it on her for very long. And I'm not, I don't want to risk her or any teacher's health in that way either. I think questions involving how are they going to implement these things in a way that's developmentally appropriate, not just for students with special needs, but all students, all children. The expectations that we're putting on them to be in an enclosed space with other children that maybe they haven't seen in 6 months, and to stay away from them is a huge expectation, especially for small children. So what will that look like, and how will it not be scary? How will it not be overwhelming? I know for my 5-year-old, I can't keep him away from the mailman every day. So we're trying to see how would this look for our kids. And it's really going to be different for every parent. And I think it's a huge decision that everyone's going to have to make about the safety of their own kids with the input of their health team as well.
We've had thank you both. We've had a question come in from Shannon. I'll ask Courtney to start addressing this question. What accommodations should we ask for now? Double vision and other eye problems, had front of class before. Now hard time with screen and vision and headaches, long day online, 13-year-old boy. So what accommodation should we ask for now? And Courtney, I'll ask you to start us off with that.
So I think, first of all, I'm sure that's really tough to keep him engaged for that long with so many difficult medical conditions. The main accommodation that I start with right now is flexibility with attendance. Because at this point, sitting in a Zoom call is not feasible for everybody for an extended period of time. So having that flexibility to be able to not attend a Zoom if that's not in the best interest of the child. Following that is breaks, and allowing for short breaks, movement breaks, or just a break from the screen. Especially if your child's experiencing headaches, double vision, that is not ideal for them to be on the computer. And so you could force your child to stay on the computer, but the truth is there's no educational value to that. If he is having headaches and double vision, there's not a lot of learning going on. So if you could work in breaks throughout the day to be able to minimize as much of that as possible, that would be my recommendation. The other two recommendations that I am really suggesting to families right now are extended time on assignments and assessments. That allows the child, again, to be able to take breaks as necessary. If a child is given a week to do an assignment, your child could be given 2 weeks to do the assignment. And that just allows for you to have those natural breaks throughout the day and work on it for a little bit and then come back to it later. And then along with that is modified work, where we focus on quality of work instead of quantity of work. We want kids to show mastery of content. We want them to stay on track academically. We want them to be able to progress with their peers. But a lot of kids can do that by doing, if the math assignment is 20 problems and your child can show mastery by doing 10 of those problems, then that's all we really need to know. Can your child do the work? So those would be my main accommodations that I would recommend right off the top. I guess one other one I thought about is verbal responses. So if the child is able to hear the content without actually looking at the screen and then provide an answer through the microphone, I don't think it's necessary for them to actually watch everything, as long as they can listen. So having the computer in one area and then the child in close proximity, but not necessarily looking at the computer, because I do know that the screen causes a lot of that double vision and headaches. So that would be another recommendation that I would have. So
That's
This
great.
is Octavio. If I could just chime in a couple more suggestions. I know that, for example, some families in our institution and some local school districts have sought out print materials, like large print materials, as an alternative to just pure screen time, and any assistive technology related to that. So I think there's a presumption that everything online means that you have to do it in front of a computer all the time. But I know of at least a few of our patients who, through an IEP and some even through 504 plans, have been able to alternate between some computer screen-based instruction and some print-based instruction that parents pick up or is delivered to their house on a regular basis. And that might be something else to consider, in addition to any assistive technology that might go along with that.
Thank you. We've also had 2 online comments that I would like to read because our audience is contributing as well, which is wonderful. So Caroline says, ideas for a 12-year-old is use long breaks from screen time. Switch to paper when possible may assist as well, and recordings of lessons.
Mm-hmm.
And then also, Adina said, I wanted to put it out there that blue light glasses really helped her son with headaches that he would get when he was working on the computer. Mandy also said, having larger textbooks, very helpful, and teachers are flexible with our daughter using that instead of doing work on the computer, and she is 11. This is great. Thank all of you. So I have another question from our Q&A, and I apologize if I'm not pronouncing your name correctly, but Najma asks, when in-person instruction resumes, what are the steps for parents to request recovery of lost services that could not be provided properly during this time? And Peggy, I'll defer to you to start answering that.
Thank you. Yes, I would start with requesting an IEP meeting. Or I'm assuming that your child has an IEP. You don't indicate that, but it seems like that. If they haven't been receiving any of their related services, their speech, their occupational therapy, then the district is obligated to provide you with those services that were missed. I have a family right now who hasn't had speech at all since we went into lockdown. And so their child is owed like 400 hours of speech and language services. And so we are in the process of requesting an IEP meeting, and we will ask that the school district either provide it with an in-school provider, but more than likely they don't have the staff that's going to be able to do that on top of continuing to deliver instruction. So maybe they will provide it through another agency, but I would start with the IEP, and because that's where things will be documented. And in the meeting, they'll talk about the learning that has been lost and look at the data. Look at data that will show how your child was before we went into the quarantine and kind of where they are now, and talk about what can be done to remedy that, but also to talk about lost services and that you would like compensatory education. That's the term to use, compensatory education. And they are obligated to provide you with that.
So another comment from Najma is, schools have said they're unable to provide recordings of lessons due to student privacy concern. Is there a workaround for this? And Courtney, I'll defer to you on this one.
So I think that every state is different and what the laws are. But what I've heard, and so I'm in Kentucky, so what I've heard with the schools that I've worked with, some schools are not seeing any issue and they're just doing it, they're just recording it. But others have had classmates sign waivers if necessary to allow recordings to happen. And they also can, if it's a liability issue, the way around that is, along with a waiver, is you can use Zoom and not show participants. So it's the teacher can see people, but the classmates maybe can't. Or they can do live recording, or like a recording where it's just the teacher only. So that would be my recommendation, is there's creative ways to get around that student privacy piece. And so if that's their driving issue, it's not in students' best interest to not have it recorded. Because even kids without special needs of any kind may have other needs, as they may have a parent that works and they don't have access to their computer during the school day, or they may not have internet at their home. And so they're trying to access the content at a different time of the day. So it's really just not okay for schools to not offer a recording of the instruction. So I would push in that direction of having them use the technology offered by the online platform that they're using to find a way around it.
Great. And then I'm going to go to one of our questions that we received at registration that I think is related to what we've been discussing. And Brandy, I'll ask you to start us off answering this one. How do I ensure my child's IEP and therapy goals are met if he is in a school system that is virtual? Is there a way for him to receive those services outside the school building?
So I know that my daughter, as well as my students, are receiving speech therapy through Zoom. It has its pluses and minuses, like everything else, but those services are being offered. My daughter was also getting occupational therapy that way. We refocused some of our therapy needs, so behavioral therapy, we refocused that to be through ABA services instead of at school. But I know other kids were getting those services as well, mostly all on like a check-in basis with parents and offering things to help support at home. Once they get into school, I think one of the biggest things that we're struggling with as teachers is how to get good assessment data. And what I've seen from my colleagues that are special education teachers is really moving towards spending this first several weeks of school working with kids one-on-one as much as possible, setting up helps to support parents in creating an environment where they can get some general assessment data the best that they can and see where kids are at. We all recognize that kids aren't going to be where we left them. You never start school in the same place that you left off. And especially when there's been so much going on, we know that lots of kids have lost a lot over this time, and we need to reassess where they are. So I think finding an opportunity for the teacher to spend a little time with children individually, and if that's not happening, they should definitely be trying to find a way to get that one-on-one information from kids. And then, you know, as a parent, trying to, if it's really important that you want your child assessed in different ways, finding ways that you can support that at home. It might be where the teacher supports you in collecting some of that data. So we have been given data collection sheets from my daughter's teacher, and we can check mark some of the data. It's not meaningful in the classroom setting, but it is maybe meaningful in ways she can support us in behavior support at home.
This is Octavio. I just want to add to that. First of all, some of our patients have reported receiving even adaptive PE from home and Braille services. So, you know, given that there's precedent, you know, I think almost anything can be done virtually. And again, as Becky was saying, it may not be, you know, as ideal as in person, but it can be done. I also want to just point out that, again, remember, if you have an IEP, the overall goal, you know, from a regulatory point of view, the overall sort of purpose or goal, or what a child should be getting from an IEP is what's called FAPE. They need to be getting what's called a free, appropriate public education. This is This is a requirement that actually comes from the federal law, from the Individuals with Disabilities Education Act. And so, again, school districts are obliged to provide FAPE even during remote learning, even during COVID-based remote learning. So in the end, one of the ways to continue to advocate and to argue for these services during COVID and afterwards, if the child has not been getting, when school resumes, is say, you know, my child is not getting FAPE. My child is entitled to a free, appropriate public education, and he or she is not getting it at this time. The other kind of just piece of advice or strategy that I always give my families is to document everything. Because a lot of times when it comes down to just, you know, your word against the school tends to, you know, kind of, you know, I wouldn't say win, but it tends to kind of, you know, have the upper hand. So, you know, for example, if the school says to you that they cannot provide certain services remotely, have them to justify that in writing. You know, one advantage of the situation that we're in right now is that a lot of things are happening through email, and so any email that you send is receive or you receive is record. It can be used as record, if not writing a letter. But anytime a school says, you know, just categorically, well, we can't do that, you know, because of XYZ, have them put it in writing. You know, maybe there's something in the justification that makes sense, but more importantly, so you have record of that. And when you need to come back and advocate for, like, the compensatory services that Peggy mentioned earlier, this kind of documentation will be advantageous to you.
Great, thank you both. I also want to mention another comment that was made in the Q&A feature that I think is very relevant to the discussion we're having, and it's from Caroline, who says some systems are also providing a contingency IEP, where there is a focus on certain goals given the virtual model and working with the parent to access data, getting related services both small and in one virtual session. So thank you for that, Caroline. There is another area that I'd like us to make sure that we address before we complete the webinar. And I have sort of a two-part question with that. And Brandy, I may ask you to answer this first part, but how do I balance the need for social interaction and the need to stay home? I want my child to feel included and have time with their peers, but I also want them to be safe.
I wish I had a really good answer for this. We're struggling with this at home. My daughter does not enjoy video chat at all with her teacher or even with her cousins. We have tried to, we gave our kids the Facebook Kids app. So we thought that might be a way they could communicate with their cousins and a way to that live across the country, but that's not fun either. So right now, we're grateful we have siblings. They have each other. Our school, my daughter's school, has set up once a week where they're calling it a play date, where the kids can just be online. The teacher kind of moderates and the kids can bring up whatever they want, share ideas. So that's one thing. A non-instructional class meeting has been something that, you know, it's not always the most helpful for my daughter, but other kids really seem to enjoy that time where they can show their pets and they can bring up different things that are happening at home and share it with their classmates. But otherwise, I think it's just keeping us ready to, like, we're ready to get to that playground as soon as we can. I wish I knew a better way.
I think some families are working together to create what they call pods, and they're, you know, keeping themselves isolated from going out into the larger community so that they can have each other to go and play with. Or that, you know, it's particularly started with people wanting to have childcare and to help with online instruction. But I think that's also something that I think was a really great idea. I don't have little children anymore, but I think I would tap into that if I did, because, you know, you'd have to, of course, have a family that would be willing to isolate like you're isolating. You know, it's like, you know, the social compact of, you know, I'm going to stay isolated, but together we're going to get our kids together once in a while, and they're going to play, and they can have, you know, without masks, and they can play in the yard. And so that's also something I've seen being done as well.
That's been the key to my family I have 2 young kids that are not school age yet, but that's been the key, is having family and or close friends that you are still isolated, but not isolated from each other.
Mm-hmm.
So I personally feel like that's a really great way to have that social interaction that kids need and thrive on.
Yeah, I think it's a common thing where you know, understanding whatever local regulatory rules are about, you know, who you can interact with. A lot of families are seeking. Well, first of all, they're ensuring that their children can practice good, you know, preventative behavior. That the children can wear a mask for long periods of time, can wash their hands. They know about social distancing. Assuming they observe that in their own children, they've identified like-minded people either in their family or in their church or their school, their community, and they've had like these mini, what they call quote unquote safe play dates outside. I've heard a lot of that happening. But also keep in mind that, you know, if you really, can't or don't want to, you know, venture out like that, social skills development is also something you can also just discuss and teach in the meantime. That's something that you can, there are books that you can use to just talk about it with your children. And you can, there are things that you can just do to mimic it, mirror it, or you can, you know, engage and play with your child, all to, you know, to something that you can do, in the meantime, while, you know, we're all sort of in this long-term lockdown situation.
Thank you all for those comments. We have another question that I think I'll start with Courtney, and then and Brandy, maybe you could address it as well, but it has to do with time management. So do you have any advice on time management for working parents whose children are virtual learners this fall? And Courtney, we'll start with you, and then Brandy, if you could address that as well.
So I'm going to start by saying, as a parent, give yourself grace. Don't be hard on yourself. Especially people that are trying to manage multiple kids, manage a job and a child, there's a whole plethora of things that you might be trying to manage at home while you're trying to help your child learn. So give yourself grace. Second, I'm going to say that, kind of go back to what Peggy actually said at the beginning, having a schedule, a picture schedule is best for kids, where they can see what they're doing all day, every day, and they know what's coming, and they're able to have breaks built in there so that they know I have to do X, Y, and Z, and then I get to go play outside for a little bit, or I get to go take a nap, or I can do whatever it is that your child likes to do. But having a very specific schedule that your child can see, that your child's part of developing, is key for their success and for their buy-in to the online learning and to the remote learning, because keep in mind that for kids, they don't learn at home. Home is their safe place. Home is their play place. They may do homework from time to time, but it's not school. So they have to learn to be able to work and do school at home. So having an area that is for school in your house can be super helpful as well. And then just that schedule to be able to do what's best for your child. And what is best for your child may not be what the school district is suggesting that you do, which is why having recorded lessons is important, and also updating 504 and IEPs to reflect your child's needs. Your child's overall health and mental well-being is first and foremost. So coming up with something that works best for them is what you need to do.
Yeah, I'll tag on to that too. I definitely wanted to say the schedules has been really helpful at our house for 3 different kids in 3 different ways. One idea, I've done lots of different kinds of schedules. I tried to get really fancy and make a computer-based one, but that didn't work because it needed to change every day. So at Target in the dollar bins, there's these things called pocket charts. and they're a piece of vinyl or like with vinyl strips that are clear, and then we put pictures in them. And the teacher, actually my daughter's teacher, provided all the images, and we can rearrange them depending on the need of our day. So we have one for Zoom class with the teacher, and we have lunch, and we have exercise and going for a walk, but there's been a lot of smoke, so we took those out. And so then we put in, you know, using yoga videos, and we can switch that schedule out as the day requires. For my son, he goes to my parents' house a couple days a week now, so that my husband gets a break to work with my daughter and without the other kids. And I make a handmade schedule for him, and he earns a sticker every time he finishes something. And lunch, he earns a sticker if he eats his lunch. He earns a sticker if he takes a break after Zoom. And by the end of the day, if he gets so many stickers, he can have tablet time when he gets home. And that helps all of us get through dinner. Being flexible with those kinds of schedules that can change depending on your needs as a parent are really helpful too. I think some of the schedules that I'm seeing from schools across the country and from even other people nearby, they are an overwhelming demand on especially small children to be online for hours at a time, or on and off and on and off and on and off at random times of day that fit in the teacher's schedule, but that are not natural for the children. So I would push back on synchronous time. So there's, you know, the big talk right now is synchronous, when you're online with the teacher at the same time, and asynchronous learning, where you're doing activities on your own time. Those times may be the weekend, and those times might be after dinner for your 20 minutes. You have time to do one activity together. I've had lots of parents come to me and say, I'm at work. What do you mean he has to be online at 12:30 every day? And I said, I'm sorry, I don't make the schedule. But what I can say is the worst possible thing that can happen right now if he misses a class is that I mark him absent. And sometimes we have to miss a class here or there, and that's not the end of the world. I would say not every day, but we all have to take a break from this. Sometimes I will say my day today started at 7:45 on the computer with students. I left school, picked up my kids, came home for this activity, and then I had back to school night on Zoom as well after this. So, you know, we all have to kind of take our breaks where we can and make this a sustainable activity for all of us, because it's not likely to end right away.
So I have two questions. We're nearing the the end of our time, but I've got a couple questions in the chat. At least one that I'd go ahead and like to address, and then one more from registration. Mandy is asking, her daughter didn't receive speech or vision in her IEP when out of school for 3 months. What is the best way to approach the school in a non-threatening, supportive way, but also advocate for my daughter who did not receive these services? And Peggy, I'll ask you to answer that, quickly.
Yeah. You can get in touch with the school, and I would call an IEP meeting amendment, just as Octavio recommended. You want the documentation, and you can be kind and gentle when you say you didn't provide services, because it's a fact, right? I'm reading it, so I want to be non-threatening. They are obligated. This is your child, and they didn't provide it, and they know they need to provide it. So getting in there, maybe calculating how many they missed if you want to do that, and then just say, my daughter needs this, and this is, I expect that you're going to be providing this, and how will you be doing that? Maybe, so yes, I see you got check-ins from her other staff. That they need, in the minimum, is to contact you by phone and find out what they can do to help support you with the vision supports and the speech. And then the speech therapy, yes, they can provide that virtually, and they need to get on it. So, you can be kind and gentle and firm.
And then we have a number of healthcare professionals who've joined us for this webinar. And Octavio, I would just like to ask you to, in the next 60 seconds, end our Q&A with this, is what is your best advice to healthcare professionals helping families navigate this new landscape in schools this fall?
Well, one of the things I would say, there are three things actually that come to mind right away. Number one is, as a healthcare professional, help to normalize the feelings of anxiety, the feelings of being overwhelmed, the feelings of being out of control. Because the reality is, we're all feeling it to some extent. And so when when a family hears this from a healthcare provider, and when it's normalized, is there something extra about that kind of, I think, anytime you normalize any situation, but when it comes from a person that's there to help and serve you, I think it just adds extra benefit. The other thing, the second kind of bit of advice that I would give healthcare professionals is that one of the best things you can do is to orient your families to the services available to them, especially in their treatment center institutions. So, doctors and nurse practitioners, point your families towards the social workers, the child life specialists, the school specialists. And then, of course, I work a lot with social workers, and so they've taught me very much about knowing your resources and inventory resources and utilizing them heavily. And so that's the other thing that I would recommend to them, is help your families get oriented to the resources available to them just right there within their own treatment center. And finally, a bit of just an advice, it may sound corny or cliche, but something that I would tell everybody across the board, be they families, be they healthcare providers, is self-care is really important. One of the best things you can do to optimize your service to your families is to take care of yourself. And I think that that's something we all need to practice in as much as possible.
Something that I would love to add real quick, I'm sorry, I know we're cut short, but as a healthcare professional, when you're trying to help a family get services, please don't ever write a prescription for IEP services of any kind.
Thank you.
As a former educator, we would get that a lot, and there's a process for everything, and a prescription is not the process. So anyways, like Octavia said, please just follow, reach out to people that know how to get those services, but it's not through a prescription.
Yes.
Great, thank you. I just want to say, I wish we could go on for another half hour, but thank you so much to our panelists for your time today and for sharing your expertise, your experience with us. And I want to thank our attendees for joining us, for your great questions. And I want you to know that the Pediatric Brain Tumor Foundation is here to help you, no matter where you are in your journey. So please reach out to us for support. You can reach out to any one of us on this slide, and we're here to help. My colleague Heather will be sending you a link to the recording of the town hall and send the resources that were mentioned earlier at the email address you registered with. So I'll talk about a few resources here at the end of the slides, but don't worry about writing them down. I'm going to go through these last couple of slides very quickly, but you'll receive a copy of the slides. The Pediatric Brain Tumor Foundation has several resources to help with your educational needs during these challenging times. Our Survivorship Resource Guidebook contains an extensive section dedicated to navigating the educational system. That guidebook is downloadable on our website, so please go and download that. Also, we have a peer-to-peer mentoring program, and many of our trained peer mentors have expertise in facing educational challenges, and those would be parents and survivors. We also have a COVID-19 resource center on our website, and our award-winning Imaginary Friend Society films, and a couple of those films also address school issues. These are the other resources our experts have provided: some general information on returning to school and COVID, other and a little more in-depth on educational law, 504 plans, IEPs, as well as resources for surviving virtual instruction. Thank you so much for joining us today. We're here to help, so please reach out. Have a great evening, everyone, and thank you for joining us.